Nursing Theorist, Patricia Benner, by Madison Holder. Hello everyone, my name is Patricia Benner. I am a retired professor at the Department of Social and Behavioral Sciences at the University of California in San Francisco. I graduated with my bachelor's degree in nursing from Pasadena College in 1964. From 1966 to 1969, I was a staff nurse in many different specialties from medical surgical, emergency room, coronary care, intensive care, and home care. I received my master's degree in medical and surgical nursing in 1970 from the University of California in San Francisco, and a PhD in stress, coping, and health in 1982 from the University of California in Berkeley. In 1984, I published my book, From Novice to Expert, Excellence and Power in Nursing Practice. I am internationally known for my research and lectures on stress and coping, skill acquisition, and ethics. My novice to expert theory is a mid-range theory. Mid-range theories are less abstract with relatively concrete concepts that address specific phenomena across nursing setting and specialties. Relationships between concepts can be defined explicitly and measured. Because they are narrow in scope, mid-range theories appear more applicable to practice and remain abstract enough to allow a wide range of empirical research. Nursing in the acute care setting is a lot different from when Florence Nightingale was practicing. Increased complexity of patients, decreased hospitalization time, and highly advanced medical technology has increased the need for expertise nurses. I have generalized the Dreyfus model of skill acquisition to nursing, with my own theory from novice to expert. In the acquisition and development of nursing skills, one passes through 5 stages of proficiency: novice, advanced beginner, competent, proficient, and expert. These levels reflect changes in 2 general aspects of skilled performance. One is the movement from reliance on abstract principles to the use of past concrete experiences as paradigms. The other is the change in the perception and understanding of a demand situation, so the situation is seen less as a compilation of equally relevant bits and more as a complete whole in which only certain parts are relevant. Stage 1. Novice. The novice nurse has no experience of real nursing practice situations. They learn about the practice out of context through lectures and textbooks. They are guided by rules. Their actions are limited and inflexible. They need help determining the order of tasks to be performed. They benefit from simulation. Stage 2. Advanced beginner. The advanced beginner nurse has experienced sufficient real nursing situations. They are able to identify meaningful aspects, but they cannot differentiate between importance of different aspects. They still need help to prioritize between aspects. Stage 3. Competent. The competent nurse has 2 to 3 years in the same or similar environment. They are consciously aware of actions as long-term goals. They feel a mastery within situations. They engage in conscious, deliberate planning to elicit actions. They lack speed and flexibility. They benefit from practicing and planning multiple complex patient care demands. Stage 4. Proficient. The proficient nurse has 3 to 5 years in situations involving similar patient populations. They perceive situations as a whole rather than separate aspects. Their perspective of situations presents itself without conscious deliberation. They use experience and exemplars. They benefit from care studies which develop ability to grasp situations. Stage 5. Expert. The expert nurse has sufficient experience to have an intuitive grasp of each situation. They have a deep understanding of the whole situation. They no longer use rules or guidelines. They automatically focus on the problem. Their performance is fluent and flexible. Their interpretive reflection on narrative can make a visible experiential knowledge. 4 key concepts of a nursing theory. Person. I believe a person is a self-interpreting being. That is, the person does not come into the world predefined, but gets defined in the course of living a life. A person also has an effortless and non-reflective understanding of the self in the world. 4 major aspects that a person must deal with are the role of the situation, the role of the body, the role of personal concerns, and the role of temporality. These all make up the person in the world. Key concept: health. My main focus is on the lived experience of being healthy and being ill. I define health as what can be assessed, whereas well-being is the human experience of health or wholeness. Well-being and being ill are 2 distinct ways of existing in the world. Health is not defined by the absence of illness. A patient may have a disease, but not be ill because illness is the experience of loss or dysfunction. Key concept: the nurse. I believe nursing is a caring practice whose science is guided by the moral art and ethics of care and responsibility. Key concept: environment. I prefer to use the term situation rather than environment. Situations convey a social environment with social definition and meaningfulness. Personal interpretation of the situation is bounded by the way the individual is in it. A patient's past, present, and future, which is made up of their personal beliefs, habits, and opinions, influence the current situation. Nursing Research Study. In 2017, Christine Thomas and Molly Kellgren used my theory as a framework in their study, Benner's Novice to Expert Model, an application for simulation facilitators. The specialty of simulation facilitators is relatively new for nurse educators. As they learn the discipline, they will go through the novice, advanced beginner, competent, proficient, and expert stages of teaching simulation. The study concluded that using my theory and applying it to the trajectory of simulation facilitators as a much-needed framework is provided to lend structure to the role. This framework provides a common language and terminology related to simulation, as well as ideas for continuing education for new facilitators. Establishment of this framework also provides a solid foundation for ongoing research in the field of simulation, as efforts continue to be made to the future of the profession. Case study. During my days as a floor nurse, I saw firsthand the transition from one stage to the next of my novice to expert theory. I particularly remember a student during her clinical rotations on my unit being very anxious about suctioning her patient with a tracheostomy. She had practiced suctioning on dummies in her simulation course, but when it came time to do it on a real patient, she needed step-by-step instructions from her clinical instructor. A year later, she ended up working on my unit. I saw the novice to advanced beginner transition over the course of a few months. She became more confident and proficient at suctioning patients on her own. Questions. What stage of novice to expert do you think you're at? Give an example of a patient experience at this stage. Do you think all nurses will reach the expert stage? Thank you so much for watching my presentation. Here are my references.